Hey hiking friends, it's Dr. Jake Giese, physical therapist, personal trainer, and I work with hikers, backpackers, and trail runners who want to stay pain-free and on the trail. And before we get into it, please like the video, subscribe, and comment at any time if there's something that you relate to or you want me to talk about a little bit more. It really helps the channel tremendously. So let's get into the video today. Today's topic we're going to be talking about is shin splints. So first off, let's talk about what is shin splints. So shin splints is essentially going to be inflammation of the tibialis anterior muscle, which is just the muscle right behind the big main shin bone. And that inflammation is usually due to overuse or poor control. And that is either due to you developing, like you're getting older, like when you're a teenager and your body's developing, and that's why you get it. It can be due to your walking or running mechanics, as well as just doing too much activity so the muscle is fatiguing out, like hiking for long distances, hiking for very steep terrain, or just running more than you're used to. So treating the shin splints, the most common things that you'll read or see, or if you've been in sports, the coaches will tell you to do when you have shin splints, is they'll tell you to take like a pain pill, an ibuprofen, elevate your legs, and put ice on your shins. And you know, that can be a temporary fix, but as you probably have noticed from either your kids or yourself or a friend that has had it, it doesn't really last for a long period of time. Other things that you'll hear or see people do are rolling your calf. Once again, it's a good exercise, or it's a good thing to do for the short-term relief, but overall long-term treatment, you know, you're not really getting the best benefit from it. So the most important thing that you need to do to decrease your shin splints is you need to focus on stretching out your ankles so that you have better ankle range of motion. And then the second one is more strengthening and better endurance with your tibialis anterior muscle. All right, so before we get into the two exercises that you should do to treat your shin splints, let's talk about a little bit more about what it is. So shin splints is essentially just a tendinitis of your tibialis anterior muscle. This is the one that connects your big toe, runs up in on the inside of your shin, kind of underneath the shin bone, and runs up and attaches at the very top here of your shin bone. Okay, its function is to do lifting the toes. So when we are running, hiking, walking, we use this muscle a lot to lift up our toes so that we don't either trip on things or, you know, we're just clearing our toes while we're doing that activity. So what we find is that when you go and you are climbing down a hill, these muscles have to fire extremely hard to not only lift your foot and clear your foot from hitting the ground, but this is what is actually helping you slow down a little bit and control your descent when you are backpacking or hiking. So that is why this gets a little bit inflamed. Same thing with running. When we are running, and especially if you land with your heel first, you're doing a lot of eccentric control or slowing down that movement, which requires more strength of the muscle, and then can, over time, doing that over and over and over again can create repetition, which just causes irritation, which then causes shin splints. Okay? So that's why shin splints are mostly due to doing too much repetitive activity. The two exercises that you should do to strengthen and increase the range of motion of your ankle to reduce the likelihood of shin splints. So the first one is going to be stretching out your heel. So in order to stretch out your heel, you can either do it by putting your foot up on a bench, you can have your foot on a step or a staircase, something like that. And you're just going to take your arms and you're going to put them on your knee, and you're just going to lean your knee over your toes, and you have to keep that heel on the floor or bench. That's the main thing. And then don't let your toes come out. Keep them straight forward. Okay? So that's how you stretch out your heel. You can also do that by putting it down, going in your typical staggered stance, keeping that back foot on the ground, keeping the heel on the ground, keeping the toes straight ahead, and then you're just pushing through that back leg, and you should feel that in your calf. So that's how you stretch out the calf, which is then going to just help you a little bit with having some shin splints. The main thing though that's going to help you reduce shin splints is working on that eccentric control of your foot. So you do that so many different ways, but the basic way that you can even teach a child to do is you just go up on your heels and you try to walk on your heels. You can go forwards, you can go backwards, and you're just going to do that, you know, I would say 5 to 10 feet. Do it 3 times, and you can just start with that. And then eventually what you would do is you would progress more and more and more, or you would do a different exercise where you would use maybe a band, something like that, and you would tie it to a post, the floor, a bottom of a chair leg, and then you can work on doing motions essentially where you're going to be lifting up the foot and pushing down the foot, lifting up, pushing down, because that's going to be creating more strength in the tibialis anterior and your back of your calf, your gastroc, and your soleus, which will then help you with that control and reduce your pain. So a thing that I see all the time with hikers is they say, you know, they're doing this, they're preparing for this bigger hike, and they're doing, you know, hikes that are already pretty strenuous for them, and they start to get shin splints, and they're just wondering like if they should continue training for that big hike. And the thing is anything with repetition, like a repetitious injury, like a tendonitis like this, you do need some sort of offloading. What I would say is instead of doing your typical hiking training, instead do something like swimming or elliptical or biking to get your cardio and strengthening in, and that will help reduce some of the tension on that tendon and help you heal a little bit better and feel better when you're doing the hiking trail. And you also should do the exercises that we are doing, like I showed you, that will help reduce some of the tension on there as well and help it heal. Inflammation usually should only last a maximum of like 3 weeks. The main part of inflammation is like within the first week, and then after that, you know, the body should heal itself. So if it's lasting longer than that, then there definitely should be modifications done to your exercise program or the activities that you're doing on a weekly basis to help eliminate the increased tension on that tendon. So hopefully all that information is really helpful if you have tendonitis of any muscle, but really shin splints. Please, like I said, comment below, like the video, and subscribe. I'm coming out with more and more content to help hikers, trail runners, and backpackers in relation to training, injury prevention, and gear. And you can also find out more information on the private Facebook group, and you'll have a link in the comments section and in the description below. Please check that out. That link will take you to the Facebook group page where we will do, you know, live trainings, as well as you'll get access to community and my videos and my own self in that Facebook group where I can help you out personally, and I help hikers and backpackers personally reach their goals one-on-one if that's what they're also interested in. So please find me in that group, or you can send me a DM on Instagram, and I'd love to reach out and help. As always, stay healthy, stay on the trails. I'll see you on the next one.